when we have constraints. For example, right now it's hospital beds or PPEs or ventilators. And hopefully sooner than later, it will be about vaccines. When it comes out, how will we distribute it in a way that most people think are fair? If for our security, we hand over ability to be followed to governments or some other authority, what will be the consequences? If businesses need to pay wages, and this is something that FICCI is specifically interested in, if businesses need to pay wages and other costs when there's no revenue, then businesses with higher costs unfairly pay the entire cost. Should rest of society, should other businesses, should the state have a responsibility? To discuss such pandemic ethics, Professor Singer is the world's foremost public intellectual and philosopher, and he is very kindly joined us. In terms of treatment of animals, on our inaction against extreme poverty, Professor Singer has reminded us of the values that make us human. At this time, both humans and humanity is under threat. And it is a phenomenal time for us and the FICCI, the larger team of FICCI and other members of Princeton Club of India to join and hear the wisdom of Professor Singer. Thank you very much and welcome, Professor Singer. My next speaker would be Siddhant Kaul from Princeton Club of India.
Thank you, Rudro. On behalf of Princeton Club of India, I welcome all of you to this afternoon session. Especially a big thank you, Professor Singer, for taking this time, joining us virtually all the way from Australia. And we really appreciate the opportunity in India to hear your thoughts and to have this opportunity to interact with you. We have an exceptionally distinguished audience here today. I thank FICCI for partnering with us, and I welcome a lot of the senior members of FICCI. We are very proud and happy to have with us FICCI President, Dr. Sangeeta Reddy, joining us. We have several eminent FICCI past presidents. Mr. Modi is here. We also have our Secretary General of FICCI, Mr. Shenoy, who will be joining us. Professor Singer is a very celebrated person, and a hint of this celebrity, a hint of his impact can be ascertained from the various descriptions that he's garnered over his long and distinguished career. These range from the most influential philosopher alive to the most dangerous man in the world. And it's been about several years. I think it's about 2 decades since he's been at Princeton. And before that, he was teaching and researching at various universities in England and Australia. In 1999, when he became the Ira W. DeCamp Professor of Bioethics in the University Center at Princeton, it was a very controversial move. There were many people who were against it because he's spoken very openly and perhaps controversially about how his thinking process works, about how he thinks about ethics. And he even made it as a subject of one of the presidential debates at the time. There was a very prominent presidential candidate who was very, very upset. But over the years, I think what's been wonderful is that Professor Singer has always kept everyone engaged. He's not let criticism bow him down. He's been instrumental in developing a very fundamental framework for thinking about what moral considerations to keep in mind when taking decisions. Some describe him as a utilitarian. In general terms, that would mean someone who takes the view that the morally correct action is the action that produces the most good. So for us, a lot of us in layman's terms, that seems like a fairly self-evident truth. But there are considerations and there are arguments that people have made against it. And I think in this sense, we can count on Professor Singha as being a defender of common sense. These considerations form the basis about how we as a society talk about questions, about how we debate, ideas, about how we debate what decision to take. Principally, and perhaps most importantly, we look at issues and questions such as, how do we value a life? Does it make sense to even think of that as a concept? Is there a way to empirically measure welfare? What is our responsibility as a society in a collective sense? And how is this balanced by the notion of individual rights? What is the approach taken that can balance all these issues? We need answers to this to live and coexist harmoniously. And I think it's very important that people like Professor Singha continue to challenge how we think about them and strive us to become better societies. Professor Singha has used his ethical foundations to think about several important issues. He's been heralded as someone who has really driven the point about effective altruism, what it means to be helping others. How do we do this effectively? And here he's led not only by thought, but by example. 10 years ago, he wrote the hugely influential book, The Life You Can Save. And he backed it up by founding a nonprofit of the same name. And this nonprofit has worked tirelessly to work with societies around the world, and especially in the lesser developed countries, to find way to get rid of extreme poverty. And Professor has talked at great length about how far we've come in the 2 decades since that book has been written. The book, I think all of you have received a link to download the book. It's available as a free download. I encourage all of you to do that. It's a very powerful message that it has. But today, in times of a pandemic, we need more than ever to use these tools. The questions that we can think about at leisure in normal times become ever more strident in today's environment. We need to make rapid fire decisions, and these decisions have tremendous impact. Often this impact can be irreversible. We are making life and death decisions for a large number of people, for large sections of society. So in today's discussions, I look forward to hearing Professor Singha talk to us about the appropriate way to think of how to make these decisions. We hope to talk about issues such as lockdowns. How do we decide when a lockdown is morally correct? How do we decide when a lockdown has served its purpose and it's no longer morally justified? In all our decisions, we implicitly or explicitly make decisions that are based on a cost-benefit analysis. For us who are tasked with making policies, this is, again, very self-evident. But every cost-benefit analysis needs to have an ethical underpinning. We can't just look at plain economics. This thing increases GDP, so it's the right thing to do. There are deeper issues today, and Professor Singha has talked at length before about the need to look for alternative measures of well-being. More importantly, how do we value lives? Different sections of society, is it morally right to value their lives differently? Older people versus younger people, is it correct, again, to pin the value of an older person any differently than a younger person? I think as people in general, we all want to do the right thing. But what is the right thing? How do we know if our moral compass is being used? How do we hone that? How can we use our moral compass to help us formulate policies that reduce the cost of pain or pain of doing the right thing? These issues, my friends, are some that I hope we have a chance to explore today, that we can think about. And I very much look forward to these discussions, and I especially look forward to a very healthy and active question and a interaction. at the end of Professor Singh's remarks. With that, Professor, I hand it to you, and we're all looking forward to your thinking on these and other issues.
Well, thank you very much, both Mr. Rudra Chatterjee and Siddhant Kaul, for the welcome and the introductory remarks. I'm also looking forward very much to hear your comments and questions on these issues. So I'm not going to give a long talk now. I want to outline my views on some of the questions that are raised by the pandemic, some of the ethical questions, and then we will, and I also will say a little bit about the relevance of the book, The Life You Can Save, and the organization, which a charity that I founded called The Life You Can Save, to this situation, and more broadly to some of those ethical implications. So let's begin then with what are the ethical considerations in relation to the pandemic? Some of these have already been mentioned. So one that is pretty clear is that if you have a pandemic and you have a lot of patients who are in need of hospital beds, perhaps intensive care beds, beds equipped with ventilators, and you don't have enough to help all of the patients whose lives are in danger and who would benefit from these beds, what are you going to do? This is a question that philosophers and bioethicists have discussed hypothetically for many years. I talked about it even before I went to Princeton. In Australia, we used to run an intensive bioethics course for healthcare professionals, and we would ask them to imagine a situation in which, let's say, there'd been an accident, a big bus had crashed, and there were many patients in need of intensive care. And how would they decide who to put on the ventilators or in the intensive care units? And you know, this has become very much a global situation now. There are countries, several countries already have found themselves in this situation. Now, some people want to say, well, the medical principle that traditionally has governed these situations is first in, first served. So essentially, if you're in the intensive care unit, for whatever reason, you will stay there, and somebody else who might need the bed isn't going to get it. And that might be okay for normal situations when there isn't likely to be a shortage, or if there is, if a particular intensive care unit is full, then a patient could be transported to another hospital with its own intensive care unit that wouldn't be full. But in a situation in which essentially they're all full, then I do think that we need to think more carefully, and that first in, first served is not really good enough, because that's not going to make the best use of resources. As was just said, I do judge the right actions by their consequences. The right actions are the ones that will have the best consequences. And essentially, that will mean, for one thing, the most lives saved, so that if you have a patient whose life you're unlikely to be able to save, because let's say they have underlying health conditions that make it very difficult, even if they have the ventilator, and you have another patient who only will need the ventilator for quite a short time, and you can confidently predict that then their life will be saved, and then you'll free up the ventilator and have it for someone else. You are going to prevent more deaths if you take the second person rather than keeping the first person on the ventilator. So that's one principle, try to save more lives. But I would say here, and again, it is controversial, that not all lives are equal. And in particular, the life of somebody with a relatively short life expectancy should give way to saving the life of somebody with a much longer life expectancy. And that in this situation means two things. One is that you give weight to age. So in Italy, for example, patients over 70, and I'm in that age range, were being denied intensive care beds, while younger patients who needed them to survive were being given them. Now, even though in those circumstances I would have been denied a bed, I think that's the right judgment to make. Provided, of course, that other things are equal. And by other things being equal, if the patient who was only 40 also had an incurable cancer, and the doctors had already said this patient only has months to live, not years, then a healthy 70-year-old with a life expectation of several years should go ahead. So it's really the number of life years that we want to save, not just the number of lives. And to me, that would be the principle. I don't want to get into other judgments about who has done more for the community. There's an argument perhaps that healthcare professionals who are needed to save other lives should get a priority so they can get back to work and save more lives. That's possible. But generally speaking, I think we should focus on life expectancy in most situations. Now, another ethical question that's arisen is how are we going to get the vaccines that we're all hoping for developed as quickly as possible? There are a number of candidates for vaccines that already have some promise, but the normal process of developing and testing vaccines takes several years, not months. And part of that process involves a long period of experimentation on animals before moving to testing on humans. Now, as was already mentioned, I have ethical views about animals which give them a lot more consideration than they typically get in most societies. So that's one reason why I'm not very much inclined to favor experiments on animals, although I may accept that there are some circumstances where the benefits are sufficiently great to outweigh the harm we do to animals. But if it's possible to leap over that stage, then it's not only good for animals, but of course it's very good for everybody else if we can move more quickly to human trials and to testing a vaccine effectively on humans. Now, there's also a time-consuming process, even if you do your experiments on animals first and have done them successfully, because you need to see whether the vaccine is really effective in relation to a particular disease. And if you simply give it to people who are at risk of getting the disease, even if they're healthcare professionals who have a higher than normal risk, it will still take you quite a long time to find out whether the vaccine is working, because they may not be getting infected. Most of them will not be getting infected. And so you need a control group and you need to see whether the control group is getting infected at a higher rate than those who've had the vaccine. But that, as I say, can take quite a long time. One possibility that's been discussed in the case of the pandemic is to have what is called a human challenge trial. A challenge trial would be where you give people a vaccine and then you deliberately infect them with the virus. And then you can much more quickly see whether that protects them against the virus. Now, that could only be done ethically with volunteers. And many people will say, well, who would volunteer to do that when the virus is a dangerous one? It does kill some people, relatively few younger people, but still not zero. But in fact, we have already quite a large number of people who have volunteered exactly for this. And these people have come out of a movement called effective altruism. And The Life You Can Save is part of the effective altruism movement. It's a movement of people who want to do good for the world, who've made that one of their important goals in life. Some of them do that by donating to effective charities in ways that I'll talk a little bit about before I finish. But others don't have the money to donate, but look for other opportunities. For example, some of them have donated a kidney to a complete stranger because they know that donating a kidney has only a small risk to oneself, to a healthy person with 2 kidneys, but can be life-saving for somebody on dialysis. So out of this effective altruism movement, there is a website called One Day Sooner. The idea being, of course, if you can get the vaccine out on the market one day sooner, you will save lives. And already around 9,000 people have volunteered to take part in human challenge trials through that website. So I think that would be an ethical option that, again, is highly desirable in a pandemic, maybe not needed in more normal circumstances. The third thing that I want to discuss is the big question that everybody has been talking about lately, and that is, how do we decide when to end the lockdown? What is it that we're trying to achieve with the lockdown? What are the costs of the lockdown? That's a very difficult question. On the one hand, some people are saying, if you end the lockdown prematurely, more people will die, and that would be wrong. They say, yes, it may reduce GDP, but you can't put a dollar value on human life. You have to do what's necessary to save human life. But I think that's simplistic, because what we're focusing on here is the people who will die because of the virus. And because we are all concerned about the virus and we can identify people who have the virus, we look at that and we say, oh, they're dying because of the virus. And if you end the lockdown now, then more people will die and effectively you'll be killing them. But what we don't look at is that economic recessions and the widespread unemployment that causes and the increased poverty also costs lives. It doesn't cost lives as directly, perhaps, although in some cases it may, particularly in low-income countries and among very poor people. But it can end them, even in affluent countries, it can cost lives because with a slowdown in the economy, governments take in less taxes, they have fewer resources, those resources can't pay for as many healthcare professionals or other public health measures, and people will die because of that. You won't be able to exactly identify it, but it can still happen. And then apart from that, I think it's not only human lives that are of value. No government spends every penny of its budget to save human lives. Governments also spend to do a lot of other things to improve the quality of life of people. Also perhaps to protect the environment in the long term, to protect wildlife or wilderness resources, national parks. They don't exactly save lives, but there are things that we value. So I think we need to have a broader way of comparing things. And ultimately, I think the standard should be, the unit of measurement, if you like, should be the satisfaction, life satisfaction that people have. Now, of course, if somebody dies, that ends their life satisfaction. But also by being unemployed for a long time, by being hungry, by getting depressed and becoming mentally ill because of unemployment, that greatly reduces quality of life and thus life satisfaction. So those are the things that we really need to try to measure and assess. And for that reason, it's not obvious to me that we should just focus on lives saved. And in particular, I go back to a point I made earlier when talking about the distribution of ventilators and hospital beds. It's relevant for how long we're saving these lives. And one of the facts in the coronavirus pandemic we're in now is that most of the people dying do have relatively short life expectancies because they are elderly. Now, I don't want to minimize the tragedy of somebody who is elderly dying. If you've lost a parent or grandparent, you know that tragedy is. And certainly, as I say, I'm in this older age group and I'm enjoying my life, and I would greatly regret if it was shortened. But I think that's still relevant to how bad the deaths of coronavirus are. And it varies from country to country, but here in Australia, the median age of people who've died from coronavirus is 80. And that's pretty similar to what it is in a number of other countries, including Italy, including the United States. So in terms of years of life lost, it's not as bad as simply the raw numbers say. For example, in the United States, just in the last week, the number of people who've died from coronavirus has equaled or passed the number of people who died in the Vietnam War. And people are saying, well, you know, what a terrible thing this is. In just a couple of months, more people have died than died in all of the years of the Vietnam War. But of course, there's an important difference in that most of the people who died in the Vietnam War were young people in their 20s who'd been drafted or were in the military and fighting. And they lost perhaps 50 years of life by dying in their 20s. And so to compare 60,000 deaths in the Vietnam War with 60,000 deaths in the US from coronavirus seems to me to be not the right comparison to make. Now, I do want to say one other thing about the lockdown that's been raised, and that is some people will say, look, it's not a matter of consequences, as I've been arguing. It's just wrong for governments to deny individuals their rights and their freedoms to move around, to run their businesses, to educate their children or to have their children educated in schools. I think it's interesting, actually, in this case, that even in the United States, and of all the countries that I'm familiar with, it's the United States where people are most ready to assert their rights against the government. This is obviously part of their history and their Declaration of Rights and their Constitution. So they are very ready to say governments should not interfere with us. But in this particular pandemic, it's been relatively few people who've done that. And they have not gone to the courts, or they've not been successful if they have gone to the courts in getting judges to say this is a violation of the Constitution. Generally speaking, the great majority of Americans have said this is something the government has to do. So I think it's interesting that even in America, this sort of absolute rights tradition seems to have yielded to the importance of protecting the health of the community. And I think that's right, even though, as I say, it may be because of the consequences that the time has come to start to scale back the lockdown, to open up a little bit. And the final thing I want to say about the lockdown is I think it's that different countries should make different decisions. And in affluent countries where there are the resources to give people security payments so that they're not going to go hungry, or to subsidize employers to keep people on in their jobs, that's a different situation from countries that don't have those resources. So I think for low-income countries, the cost of a lockdown is much more severe. And I think it's much more reasonable for them to not have a lockdown at all, or to have a lighter kind of lockdown with more opportunities for businesses to run, or to shorten the lockdown and allow businesses to reopen. Good. So finally, I just want to come back to the question of the organization, The Life You Can Save. And I do hope that many of you will download the free audiobook that you can get from the website, thelifeyoucansave.org, or you can get the ebook. Currently, you can get that from Amazon on Kindle for just 99 cents. And I hope you'll look at it. But in brief, The Life You Can Save is trying to help people to find the most effective organizations to both save lives and improve the quality of life of people in great need. And I think that's really important because not all charities are the same. Some charities do much better work than others. They're much more effective, and you get much better value for your money if you use those charities. And it's a little strange to me sometimes that people look for value for money automatically if they're buying something from themselves. They're looking for good value when they buy a new phone or a computer or a car. But when they give to charity, they don't think about that nearly so much. And that seems to me to be a mistake. If you've got limited resources to give, why not try to do the most good you can with your donation? And the Life You Can Save does recommend a number of charities working in India and that are available for Indians to donate to. And some of these are working on the COVID-19 issue. In particular, perhaps the easiest one to donate to if you are in India is Oxfam India, since that's an Indian organization that is worked for a long time with disadvantaged communities in India to protect them, to assist them. And now in the COVID pandemic, it's raising awareness about COVID-19, trying to provide protective equipment, safety kits, and to essentially educate people about staying safe in this situation. We also have other organizations working in India, but they're not, I think they may be more difficult for you in India to donate to, but we have organizations such as DREV, which designs special medical equipment in India very cheaply. We have Evidence Action, which scales up evidence-based and cost-effective programs to reduce the burden of poverty for hundreds of millions of people all over the world, and in particular is involved in the Deworm the World initiative in India. India is the country with the highest number of worm infections globally, and Evidence Action is working with the Ministry of Health and Family Welfare on deworming. I've already mentioned Oxfam India, and the other one is GAIN, the Global Alliance for Improved Nutrition, which is trying to increase the consumption of nutritious foods among vulnerable populations, especially women, girls, and children. So if you want to know more, do look at the website of thelifeyoucansave.org and look at the book as well. Okay, I've gone on a little bit more than I thought, but I hope we'll still have time for quite a few questions, and I look forward to hearing your questions. Thank you.
Thank you, Professor Singer. That was very thought-provoking, and I know there'll be a lot of questions. I just wanted to take a moment to welcome President Dr. Sangeeta Reddy. She's joined us, as have the Secretary General, Mr. Dilip Chennai. And we have a great audience for this show, and I would want Anam Vadgama, if she could take us through the question and answer round. Thank you.
Thank you, Rudra. Welcome again, Professor Singer, and thank you for sharing with us your thoughts. It's great to have you here. We have some questions that some of our audience members will ask you directly. And so our first question is from Dr. Sangeeta Reddy, who is the president of the Federation of Indian Chambers of Commerce and Industry, and she's also the joint managing director of Apollo Hospitals Group. So over to you, Dr. Sangeeta.
Provoking session that you've given us. I believe that, you know, the situation is extremely complex, and the battle that healthcare workers are having on one side, individuals and families having on another, and then governments and businesses. So everyone is in this, you know, entire stage of change management, or from denial to acceptance, and a deep sense of fear. And the Life You Can Give is a wonderful initiative. I really congratulate you on that. But the question I wanted to ask you is that, you know, in this environment, I think leaders are posed with multiple ethical questions as well. And there's the question of their own business survival, and then it's about the lives and the livelihoods of their people, and of doing the right thing. And so, is there a framework for decision making that you would use, or that you would recommend on these choices? Because I think, you know, the choice of, you know, choosing a ventilator for a young man versus an elderly, while it's a difficult decision and heartrending, sometimes seems a little easier than protecting my company to you know, keep employing 5,000 people, or today making sure I'm able to take care of 5,500 people. So is there a framework for this difficult ethical decision making, even in the non-medical space?
Thank you very much for that question. You're right that these are very difficult issues. The framework that I use is one that tries to assess all of the consequences of your choice. And so the issue that you raised about trying to continue to employ 5,000 people, obviously the impact that not continuing to employ them would have on them is a very major concern. And you need to look at that, at what that is. Against that, there may be some risk if you continue to run the business of some of them getting infected and some of them even dying from the infection. What can you do to minimize that risk? Perhaps there are things you can do to have people more at risk, elderly people or people with underlying health conditions, working from home, and where people do have to be in closer contact with each other to continue the business, having young, healthy people who volunteer to take on those roles. There may be things that you can do like that. But it's always a very difficult calculation. And of course, as a philosopher, I can't tell you what decision to make with your company or any other leader, because I don't have the relevant facts, and it may be extremely difficult for you to gather these facts too. They're not facts that we are used to looking at every day. You know, we're used to looking at economic data. What's the bottom line here? Are we continuing to make a profit? But now we have to look at other data about the effect on loss of life and the effect on quality of life. I would hope that one thing that comes out of this pandemic is that we do more to support people who are good at getting that data, the scientists who look at quality of life assessments, and try to tell us more about that. But in the end, you can only make the decision with the data that you have at the time. And that's why you can never be absolutely certain that you're making the right decision. But by looking at what are the consequences of your actions, I think you can get closer to making the right decision than if you don't look at that.
Thank you very much.
Thank you.
I often say that it's the data, the science, and the sentiment which is guiding us in these decisions, and these are difficult times, but thank you for your session.
Certainly. Thank you.
Thank you, Dr. Sangeet, and thank you, Professor Singer. That was incredibly helpful. For our next question, we have Mr. Rahul Mehra, who is the immediate past president of the Princeton Club of India. And over to you, Rahul, to ask your question to Professor Singer.
Thank you, Professor, for your time all the way from Australia. Professor, what I wanted to ask you is that even before the COVID pandemic, inequality within countries was at staggering levels. And with this lockdown, just in the past 5 or 6 weeks, 30 million Americans have filed for unemployment. We can't even quantify in India, but well over 100 million migrant laborers have left their jobs or are trying to make themselves back to their villages. Whenever the recovery comes, and I'm not discussing or debating whether the recovery will be U-shaped, V-shaped, or even L-shaped, but whenever the recovery comes, don't you think it'll worsen the inequality that was happening, even going into the crisis? And if so, what does that mean for the post-COVID world's politics, economics, and populism?
Yeah, thank you. That's a very good question. And a lot of people talking about this in the United States are hoping that somehow the more community-oriented spirit in the US, which I sort of referred to when I said that people are prepared to make these sacrifices and give up what you might have thought were basic rights for the sake of the community, that will somehow flow through to providing a more egalitarian future for the United States. I have to say that I don't believe that that's at all certain. And for one thing, I think it depends on the November election. And my view would be that if the Republicans get back both a majority in the Senate and the presidency, we're not going to see any great decline in inequality. In India, it's maybe a different situation, and I'm certainly in no position to comment on what's likely to happen in India. But I am aware of the situation with migrant workers. That was, I'd read about that, and certainly I think they need a lot of help, and other people in poverty need help as well. It's such a huge and difficult problem, though, that I have focused more on trying to help those in extreme poverty. So my priority has not so much been in reducing inequality as such, but in trying to help those people who are below the World Bank's international extreme poverty line, which is roughly the purchasing power parity for $1.90 US per day. And India still has quite a number of those people. In fact, until fairly recently, I believe India had the largest number of people in extreme poverty in the world. Fortunately, that has declined in India, and perhaps unfortunately, the number of people in extreme poverty in Nigeria has increased. So my understanding is that India no longer has the most, but it still has quite a large number. And I would like to see a priority in helping those people to at least have the basic necessities for life. And if India can do that, if organizations can work towards doing that, I think that would be a major achievement.
Thank you for your reply, Professor.
Thank you.
Thank you, Professor Singer. Thank you, Rahul, for the question. For our next question, we have Mr. Y.K. Modi, who is the past president of the Federation of Indian Chambers of Commerce and Industry and the executive chairman of Great Eastern Energy Corporation. So over to you for your question.
Thank you, Doctor. I think the point of personal freedom versus government responsibility, lives, livelihood, etc., are more political questions rather than ethical questions. So ethics is, as I understand the point which you said, that who will decide whether somebody lives or dies, if an old man goes or a young man goes. So according to me, we should not be playing God, and whoever goes in first gets the first chance of medical treatment. And that's the way, at least my religion tells me the ethics is.
Okay, well, certainly that is an ethical issue, but I have to say that I don't agree with that view, and I'm not sure that I think I would suggest it's an interpretation of a religion that may say this, because obviously none of the religions set down their basic precepts in an age when there were ventilators. There may be other issues about resources, but I think that really, we are the ones who have to make this decision. And to say it's playing God is, I regard as a kind of way of escaping responsibility for a choice. Because if you say the person who gets there first gets the ventilator, there's some human being who's making that choice, and they have to take responsibility for that. And if the consequences of that are that a person occupies a ventilator, let's say for a month, and then dies, and that was predictable at the time that the person was put on the ventilator, then that's a mistake, because that ventilator maybe could have saved 4 or 5 people during that time, instead of one person who was not really expected to live very long anyway. So I think we have to take responsibility for that choice, and I would be prepared to do that. And certainly I know directors of intensive care units who I've been involved with in discussions over the years, who accept that it is their choice and their responsibility, and are prepared to make that decision if they have to.
Okay. I don't agree, but I get your point.
That's what ethics is about. It's about discussion and disagreement, and we should be able to have those disagreements and respect each other's viewpoint.
Yeah. Thank you.
Thank you, Professor. For our next question, we have Professor Sumantra Bose, who is the Professor of International and Comparative Politics at the London School of Economics.
Hi, Professor Singer.
Hello,
Professor. It's really nice to listen to you. I'll be brief. Do you think that the silver lining of this very dark period that we are living through might be that the everyday predicament of the world's poor. Hundreds of millions of people in India are facing an existential crisis as we speak, and the number is, of course, in the billions worldwide. Do you think that the silver lining of this very dark period might be that their everyday predicament might move from the margins and the shadows into the center stage of global politics and the world's conscience? Or will they fall by the wayside again in a matter of time?
I would like to believe that there is that silver lining and that the poor will be more the focus after this pandemic. But I have to say that I'm not greatly confident about that, because I'm not sure that, you know, once it's over, that the forces that have essentially neglected the situation of the world's poor will still be there. And is there going to be sufficient pressure from the people as a whole? I think that most people are compassionate, and that most people, if they understand the situation of the poor, and if they understand that there are effective ways of helping them, would want to help them. But it's, you know, in a sense, they're not making all the choices. A lot of the policy choices, trade policies and so on, are being made by political leaders, and a lot will depend on whether those political leaders are in power, and certainly some of them will be in power and will stay in power, and I don't think their priorities are going to change very drastically. I'm sorry to say that.
Very realistic. I do agree with you, unfortunately, but
Thank
we'll
you.
see. Let's hope for the best.
Yes, we can hope, definitely, and try to push it as well. Do our best for it.
Indeed.
Thank you, Professor Bose, and thank you, Professor Singer. We received some questions from the people who registered via email, and so I'm just going to read out some of those since we have some more time. There's a question from Mr. Kanish Kanodia from Princeton University, who says that in times like these, when even the developed world is struggling to provide adequate amenities to its citizens, do you think that they still have a moral imperative to help the developing world?
Oh, I definitely think that the developed nations have a moral imperative to help the developing world. And the reason for that is a little bit like my reasons for wanting the ventilators to be used best to save the largest number of people. I want the resources to be used best to save the largest number of people too. And it's still much less expensive to save the lives of people in low-income countries than it is in affluent countries. So I think that that's the primary reason. When you have people in extreme poverty, they die because often they can't get things that are very, very cheap, and we could provide it for them. And that's what the effective charities supported by the Life You Can Save are generally doing, saving lives for really small amounts. Whereas in the United States, even, you know, they're devoting a lot of resources to trying to fight the pandemic, and you know, they're doing that, but those resources could actually save more lives elsewhere. Now, of course, I understand that every country is going to give priority to its own citizens in an emergency, but ideally, we would have a more global outlook. We would value the lives of people similarly, whether they're fellow citizens or whether they're people in another country on the other side of the world. And we would try to pool resources to use them to do the most good for everyone. So I think even in an emergency, that's what we should be doing.
Thank you, Professor Singer. We have another question from Ms. Sonia Naidu, who's a research scientist at St. Gobain. How do we ethically justify putting in the measures that we have for COVID versus what we've done for other infectious diseases such as TB and malaria? Why is COVID different, and do the reasons justify paying more attention?
I think the key reason why we are putting so much resources into COVID is that it's a disease that doesn't discriminate against the poor. It's or at least in general it doesn't. It certainly affects people who are wealthy and who are affluent. So that's why a lot of resources go into it. When diseases only affect people who are poor, the rich countries don't put many resources into that. We saw that very clearly with Ebola, when there were outbreaks of Ebola in Africa, and they only threatened people in Africa. Virtually no resources went into trying to combat Ebola, find a vaccine for it, or find a treatment that was effective for it. Once in the last outbreak in Liberia and Sierra Leone, when some cases did start to spread to Europe and a very small number to the United States as well, a lot of resources started going into it, and that proved quite effective in finding a better treatment for it. Now, malaria, generally speaking, is not a disease of affluent countries, but it is a disease of poor countries. And that's why not very many resources had gone into that. Although I have to say that Bill Gates and Bill and Melinda Gates and the Bill and Melinda Gates Foundation have put a lot of resources into that. But I think that's why that somewhat disproportionate amount of resources have gone into COVID-19, because it does take the lives of affluent people. So they're worried about it. Their governments are worried about it. Political leaders get it. We've already seen that with a number of political leaders. So their governments are making this a priority too.
Thank you, Professor. We have another question from Amrita Chatterjee, who asks, thank you, Professor. What will your message be for the youth of India now, as a lot of them will lose their jobs or may not get a new job?
Well, my message is not to give up hope of getting a job. I do think that this will pass. It may seem very grim at the moment, but it is going to pass. The economy will start growing again, and there will be jobs available. So my message to the youth of India is prepare yourself for the opportunities that will be coming if not in the next month, then in the next years. And be ready to do that and to find jobs that are effective in helping India, that will be satisfying for you by knowing that you are doing a great deal to help people in India. And as we've already been emphasizing, with a particular priority for helping those who are already worst off.
Thank you, Professor. I'm going to read out a few more questions that we received via email. There's one from Captain Gajanan Karanjikar, Blue Economy social activist. There are a series of questions, so I'm just going to call out all three of them. What will the new world order be after the pandemic, and how would the new normal be? Would it be the same as before? And humans are social animals, and post-pandemic, we expect socializing will impact us for a great length of time. And how would this impact the mental health of human beings?
Well, to take the last one first, if we don't socialize, it will have an adverse effect on the mental health of human beings, undoubtedly. Fortunately, this has happened in the age of the internet, and we can communicate without risk of virus, as we're all doing right now. So that may help a bit. But I do think that we're social beings, and that's going to be important. And that's also a reason for at least easing up on the lockdown a little bit. In terms of the new world order after the pandemic, we've talked about that a little bit, but I can't really see the future. And I would like to hope that it will be different, that it will be more egalitarian, more focused on those who are worse off. But I think once the risk has been alleviated, either because we've developed herd immunity or because we've got an effective treatment or a vaccine, I fear that we will go back to where we were before it. I'm not confident that it'll be a different world order.
Thank you, Professor. I'm seeing that we're having a lot of questions on the chat. So I'm just going to go through some of those. We have a question from Shiv. People have been talking endlessly about how they are delighted to see clean rivers and hear birds chirp. Do you believe that this will be a lasting sentiment?
Well, I think people would always be delighted to have clean rivers and clean air, no question about that. But will enough be done about that to ensure it? Maybe once people have seen that they can be clean, they will try to put more pressure on the pollutions, whoever is polluting the river, to stop that and to go back to to it being clean. I do think that's extremely important. And I do think that if you make enough effort, we can have clean air and clean water, and combine that with a flourishing economy and an industrialized economy. But it does take an effort, it does cost something. So perhaps people having seen that will put more pressure on it to stay that way. I hope so.
Thank you, Professor. I think we have time for one last question. Rudra, would that
Sure.
be all right?
No, last question, yeah, of course.
Fantastic. We have a question from Mudit Jain. My question is this epidemic and others in the past caused by our meat-eating diets? If we were vegetarian, then would these pandemics not occur?
Well, that is a very good question, and I'm glad it was raised. And I'm convinced that the answer is actually yes. If we were vegetarian, and I know India has the largest number of vegetarians in the world, but also a lot of people who are not. If we were all vegetarian, then this particular pandemic would not have arisen, because it seems fairly clear that this came out of the wildlife market in Wuhan, and the virus was probably spread to humans through bats and possibly pangolins that are eaten in China. But even apart from that, and that gives us a very good reason to close these so-called wet markets where live wild animals are kept in horrible conditions and then slaughtered on the spot. But even apart from that, the previous pandemics and epidemics, for example, the previous pandemic recognized by the World Health Organization was the swine flu pandemic of 2009. That clearly came out of factory farms, out of pig farms in the United States. So that would not have happened if we did not have these huge agribusiness factory farms. And in fact, factory farms are an ideal breeding ground for viruses. We've also had varieties of avian influenza develop out of factory chicken farms, because you have tens of thousands of animals packed together in a single building, very crowded, often with weakened immune systems because of the stress of the crowding. And so they don't resist viruses, and the viruses have every chance to mutate through the buildings. And then they get into the workers who are working with them, and in that way they get out to the human community. So I hope, this goes back to our hopes about the new world order after the pandemic. I do hope that there will be much greater pressure on this factory farm method of producing meat, and that people start to move away from meat to more plant-based foods. And if they are going to eat meat, that they get meat from traditional farming, where animals are outside, where their immune systems are stronger, where there are fewer animals, so they don't develop viruses in such a kind of pressured hothouse atmosphere. I think that will be an important thing if, after this pandemic, we recognize the immense costs of pandemics, and we say we are prepared to take serious steps to reduce the chances of pandemics occurring in future.
Thank you, Professor Singer. Thank you, Anam, for asking these questions. We dealt with questions in a Chamber of Commerce webinar that we rarely deal with. Questions of life and how do you choose who lives. Questions on jobs. Do you take away a lot of jobs, or to sustain the jobs you have? And questions about food, which is as dear to many as life itself. Thank you for making the time. I would request Siddhant Kaul to deliver the vote of thanks. But thank you on behalf of FICCI, Professor, for making the time.
Thank you. Thank you very much.
Professor, on behalf of PCI, thank you so much for spending so much of your late Melbourne night with us. We wish you, that you stay safe. Your country is in the lucky position of being very far along the curve, and hopefully at the end of the epidemic. And I hope that in India, we are able to